Hello, everyone. Thanks for joining us. My name is Lexi Beer. I'm the Director of Outreach at KGI, and I want to introduce our webinar today. You have with us Dr. Jun, who is our Chair of Clinical and Administrative Sciences and Associate Professor in the School of Pharmacy and Health Sciences here at KGI. So she'll be talking about ambulatory care pharmacy today, and thank you so much for joining us. Take it away.
Thank you very much for the introduction. I'm actually going to share my screen to get started. So thanks again for joining us. My name is Jeany Jun again, and I'm going to be talking about the ambulatory care pharmacist because most students, when they consider going into pharmacy, they usually think of two routes. One being community pharmacy and the other being hospital pharmacy. But I wanted to show another option for you, which is the ambulatory care pharmacist. I have three main objectives. The first is to know what kind of education and training is required to become a pharmacist, and then list some additional certification that might be required to become an ambulatory care pharmacist, and then describe what pharmacists can do in ambulatory care clinics. So I'm actually going to start with the big picture of pharmacy, and then go on to education required and share some personal stories as well. So in 2020, a survey was done by the Center for Health Workforce Studies at the University of Washington, and they found that the most frequently identified pharmacist roles were as follows. And you can see the largest words being medication dispensing, but also with this come medication therapy management and chronic disease management, as well as transitions of care, patient education, health promotion, and disease prevention. Now, ambulatory care pharmacists don't do any medication dispensing, but they do medication therapy management and chronic disease management. So this is where we're going to be focusing most of our attention today. But to give you the big picture, in the United States currently, we have about 312,000 pharmacists that are employed. When I graduated back in 2001, there were only 224,000 pharmacists. Now, out of those 312 licensed pharmacists in the United States, about 43,000 of them have active specialty certifications. And faculty at our school have board certifications in ambulatory care, of which I am one, pharmacotherapy, cardiology, geriatrics, infectious disease, psychiatric pharmacy, critical care pharmacy, and nutrition support pharmacy. And so just to give you some quick facts, pharmacists make about $125,000 per year, which works out to about $60 an hour. And you need to have a doctor of pharmacy degree in order to get the pharmacy positions. And on this list, there are actually over 100 different pharmacy career options. Most students know of the hospital pharmacist and the community pharmacist, but I'm going to talk about the ambulatory care pharmacist to be able to expand a little bit of what you guys may be thinking of when you think of considering pharmacy as a career. So in 2019, the American Pharmacists Association produced a study, and they do this actually every 5 years, and it's called the National Pharmacist Workforce Study. And you can see from here that community pharmacists make up about half of all pharmacists who work, and about 28% work in the hospital system, and ambulatory care pharmacists only make up 6% of the workforce, and the rest work in nursing homes or in managed care. Now, you may think 6% is little, but if you look at the data over the past 10 years from 2009, there were actually less than 1% of pharmacists working in ambulatory care. In 2014, about 1.2% worked in ambulatory care. And in 2019, it grew to over 6% of pharmacists working in ambulatory care. So all that to say, ambulatory care pharmacy is a growing area of pharmacy. And many studies have been published which actually show that if a pharmacist is involved in a patient's care, it actually leads to improved health outcomes, especially for patients with chronic diseases such as diabetes, high blood pressure, and cardiovascular disease. And so I'm going to shift gears and talk a little bit about what it takes to become a pharmacist in their education and training. So most students, if they want to go into pharmacy school, will need somewhere between 2 to 4 years of prerequisites or actual bachelor's degree. And most of our pharmacy programs, especially in California, are going to be 3 or 4 years long. And at the end of that, you get a Doctor of Pharmacy degree, which is abbreviated a PharmD. And when you get your license in California, you get something called a registered pharmacist license, which is denoted by the RPH. Now, some students, once they finish pharmacy school, they decide to go on for additional training, and we call them residencies. And a PGY1 just means postgraduate year 1 residency, which is generally a generalized residency. And then some decide to go on to a second year PGY2 with a specialization with something like ambulatory care or infectious disease or critical care. And then in order to become board certified, you have to take an exam and pass it. And if you have both a residency and board certification, you can actually in California apply to have the advanced practice pharmacist licensure, which is denoted by an APH. Now these three, residency, board certification, and advanced practice pharmacist licensure, are all optional. So just to say, there's a lot of different variety of training, even amongst pharmacists. Now, what most people would be familiar with are the pharmacist roles in community or retail settings, where the pharmacists are filling and dispensing prescriptions that are written by healthcare providers. Now, in hospital pharmacy roles, pharmacists there will be preparing medications for those patients who are hospitalized at their institution. You may also have pharmacists specializing in the ICU, doing critical care, as well as those specializing in patients who have infectious diseases, so that they know the best antibiotic or antiviral medications that may be required. You also have pharmacists who are making IVs and making fluids for the patients to be able to receive them at the hospital. And pharmacists will also provide discharge counseling once the patient is ready to be able to go home. Now, ambulatory care pharmacists, we get the word from to ambulate or to walk, meaning ambulatory patients are those who can still walk around even though they have an illness. So most patients with chronic diseases are considered ambulatory care patients. So you may be aware that diabetes and high blood pressure are one of the two very common chronic diseases that most patients have. So I think somewhere about 90% of people over the age of 55 eventually develop high blood pressure. And many people in the United States also have diabetes. Pharmacists also began their work in managing patients in anticoagulation, where patients were initially started on blood thinning medications called warfarin, because they needed to make sure that their blood is not too thin so that they don't bleed out, but also it's not too thick so that they don't have a stroke or a heart attack. In addition, there are pharmacists who work in mental health, where they're taking care of patients with anxiety and depression, because we're managing all of their disease states with medications. And pharmacists are the drug therapy experts. Now, I wanted to share a timeline of what pharmacists or how pharmacists started engaging in chronic disease management. And it was actually in 1974 where pharmacists had their very first post-diagnostic prescribing authority that was granted to them if they practiced under something called a collaborative practice agreement with the physicians. And so the pharmacists, once they had a diagnosis, were able to treat chronic conditions with medications. And this happened primarily initially in the Indian Health Services because there were not enough physicians who were willing to go out to the reservations to care for patients out there. And then in 1995, the VA system, the Department of Veterans Affairs, finally signed their collaborative practice agreement with pharmacists in order for the pharmacists to be able to independently have prescribing privileges to care for patients with chronic diseases. And in California in 2014 is where we got Senate Bill 493, also known as SB 493, signed into law. Now we are in 2022, and we're actually still waiting for the federal government to recognize pharmacists as healthcare providers nationally so that we can bill for Medicare and Medicaid. Now, I want to talk a little bit about SB 493, which was approved in January of 2014, because in California, they recognized pharmacists as healthcare providers, and they expanded the scope of practice for pharmacists to provide disease prevention. So SB 493, what it allowed pharmacists in California to do is to first furnish hormonal contraceptives. So now you can actually walk into a community pharmacy to get your birth control pills. They can also provide nicotine replacement products to help patients quit smoking. And as you may all know, pharmacists are allowed to provide child and adult immunizations, and pharmacists were very active in providing COVID vaccines during the past year and a half or so. Now, pharmacists who have additional specialization are also able to provide travel immunizations and medications, and they're also allowed to order and interpret laboratory tests. Also, this SB 493 is where it created a separate license category of the advanced practice pharmacist. Now, they have to meet 2 out of the 3 requirements, one of which is a residency, board certification, or they worked under a collaborative practice agreement somewhere for at least 1 year. And so what's special about being an advanced practice pharmacist? Well, it expands their scope of practice. It allows the APH pharmacist to perform patient assessments, order and interpret drug therapy related tests. They can refer patients to other healthcare providers, and they can initiate, adjust, or discontinue drug therapy and participate in the evaluation and management of diseases and health conditions. Now, I mentioned the collaborative practice agreement, and basically what that is an agreement made between the physicians and the pharmacists to allow the pharmacist to manage certain patients and then define the scope of practice of what the pharmacist can and cannot do. So when I worked under a collaborative practice agreement, I was able to prescribe under the physician's license. Now, what are some things that ambulatory care pharmacists do? They provide disease management, they do patient education, and they also provide drug information. And we work as part of a team. We work with physicians, other pharmacists. We work with nurses and certified diabetes educators. We work with registered dietitians, social workers, and marriage family therapists, because it really takes a team to be able to improve health outcomes for a patient. So I wanted to show you the work environment of an ambulatory care pharmacist. And so here is an exam room, and it's like your doctor's office where you have individual opportunity to sit down with your patients and talk with them one-on-one. We have a glucometer here. We also have food models available for any type of patient education that we provide for our patients. And so how ambulatory care pharmacists work is they identify a special subset of patients where we say, okay, all patients who have high hemoglobin A1C levels, which actually tell you how controlled or uncontrolled their diabetes is with high blood sugar levels. We get a referral from their physician, we schedule the patient, and they arrive at their appointment, and we help manage their diabetes or other disease states. And then we actually follow up with our patients in a week or a month. And once they get to the outcome that they want, or an A1C goal or a blood pressure goal, then we discharge them back to their primary care provider. So disease state management allows the patient and the pharmacist to meet together. The pharmacist interviews the patient, they assess control of the patient's disease, they provide a plan, and then they follow up with the patient. So I get to walk alongside my patients for 3 to 6 months, sometimes up to a year, until they are able to achieve their goals for their outcomes desired. So I'm just showing you some blurred pictures so that we can't identify any of the patients, but this is me in the lab coat. I'm seeing a patient with type 1 diabetes to help them manage their diabetes control. And they would come back, we would help adjust their insulin therapy, as well as talk about what diet strategies that we can have so that her A1C comes under better control. These are not real patients. But here's a resident and actually one of our nurses. And as the pharmacist is checking a patient, we obtain their vitals. We get their weight, blood pressure, heart rate, respiratory rate. We also check their glucose, and we have the machines to be able to check their A1C, which tells us over the past 3 months how well their blood sugars have been controlled. And here's an example of a sheet that I give out, or I actually assess a patient's blood glucose values. And I see, well, where are they having problems? When are they having really high blood sugar levels? What are they eating? And what kind of medications can we provide to better help control some of these glucose values? And so, as I mentioned, sometimes when the physicians are starting a patient on insulin, they don't have enough time to sit down with them, teach them how to use their new insulin pen. And so then they'll refer them to me, and I teach them how to use their, for example, Lantus Solastar insulin injection pen. I go through the steps, have the patient demonstrate it back to me, and then I say, you know what, in a week, I want you to come back and I'm going to actually help titrate your dose so that we get your blood sugar under control faster. And here I'm providing a plan for the patient. This is the dose of the insulin, for example, that they should be taking with specified numbers so that we are basically holding their hand to be able to say, okay, if this happens, do this. And then you know what, I'm going to see you back in about 2 weeks to make sure that the plan is going well. And here's an example of a patient-friendly medication chart. And you'll notice it's written in Spanish, as most of the patients that I saw at the clinics that I worked at were Spanish speaking. We also provide education on foods, carbohydrate counting, portion control, and the plate method. So it's not just about talking about medications, but holistically looking at the patient and trying to help improve what they're eating, as well as what kind of exercise that they're able to tolerate and do. So we're providing lifestyle education, how to lose weight, as well as managing their medications. The types of patients that I saw at the ambulatory care clinics that I worked at were predominantly diabetes patients who were initially referred to control their diabetes. But as you know, nobody just has one disease state. They have multiple others. And so these are some of the other disease states that I was able to help manage in the patients with diabetes: high blood pressure, depression, pain, asthma, as well as anticoagulation for patients who are on warfarin. In addition, once you are done seeing the patient, we have to write a comprehensive progress note so that we can communicate the details of the interaction with other providers. So pharmacists in ambulatory care have access to the medication chart for the patient so that we can look at their laboratory values. We look at what other medications they're on, what allergies they have, so that we can come up with the best plan. And we put the medication, communicate the details of everything that we've done, whatever changes we've made, any titration of the doses that we've done, and we communicate it back to the provider so they know exactly what's been going on every time they come and see the pharmacist. Now, billing for service for pharmacists' cognitive services, challenges still remain because we still do not have federal ability to be able to be recognized as healthcare providers. And therefore, we still cannot bill Medicare or Medicaid for these cognitive services. When I worked at a diabetes clinic, we were able to bill for group counseling or individual counseling for patients. So we were billing for time spent educating our patients for diabetes, as an example. Now, one of the ways around it, we usually have a compliance officer at the clinic who makes sure that we are compliant with all the rules and regulations. And one of the ways that we're able to bill for the pharmacist seeing the patient is when the physician physically touches the patient to be able to bill for services. So as an example, I spend 30 minutes with the patient going all of their education, their medication adjustment, and then the pharmacist, the physician comes into the room and says, "Hi, Mr. Patient, do you have any questions for me?" And then we bill for services for the pharmacist. Now, Initial visits I got to spend is about 60 minutes with my patient one-on-one, and follow-up visits I get to spend about 30 minutes. When I looked at my record of patients that I've spent time with, I spend an average of about 43 minutes with each patient, each face-to-face encounter, and had an average of 6 encounters per patient to be able to get them to goal. And so here's an example of a study that I did, just looking at all of the patients that I saw over a 2-year time period. They had an A1C starting at around 12%, which means their blood sugars are in the 300 range. After about the first 3 months, we were able to safely get their A1C down to about 8%, which means that their blood sugars are now in the 150 to 180 range. And then 6 months later, we were able to get near goal of 7.4%. So these are some of the activities that pharmacists in ambulatory care can do. And I would be happy to answer any questions that you guys may have.
Can you talk a little bit more about the board certification?
Sure. So the board certification is available once you have your doctor of pharmacy license. And board certification also has some minimum requirements, meaning you have to have done 1 year of residency, or if you didn't do a 1-year residency, you actually need 3 years of experience in order to have the right to sit for one of the specialty areas. So board certification in pharmacotherapy, which is abbreviated BCPS, you need 3 years of experience or 1 year of residency. For ambulatory care certification, you actually need 2 years of residency, first year in general, second year in ambulatory care. And if you don't, you actually need 4 years of experience in order to be able to have the qualifications to sit for that exam. And it varies for the other types of certifications, geriatrics, cardiology, et cetera.
And do you work at like a private clinic, or how does that work for ambulatory pharmacy?
So there's many different kinds of ambulatory care clinics, and no two are exactly the same. So as I mentioned, the VA has a lot of ambulatory care pharmacists working in their chronic disease management clinics. Kaisers also have a lot of pharmacists working in ambulatory care clinics because pharmacists are technically cheaper than physicians, and they actually know the most about medications. And so we're not diagnosing, they already have a diagnosis. And once they have a diagnosis, patients with diabetes, there's like 60 different kinds of medications just for the treatment of diabetes, if you include all the insulins and the oral medications and the injectables. And so the pharmacists are able to manage them. So when I was working at primary care clinics embedded with physicians and residents. And I had a collaborative practice agreement where they would refer their patients with uncontrolled diabetes to come see me. Or they would start the patient on insulin and they say, go talk with Jeany, the pharmacist. And I would be able to have them and manage them for a time being. So I've always worked in primary care. You may have heard that there is a primary care shortage because physicians, most of them are going to medical school and they're specializing. And so that's why we have physician assistants and we have nurses who are trying to fill that primary care gap. I really think ambulatory care pharmacists are also able to fill that primary care shortage because we are embedded in primary care clinics. Thank you for asking those questions. Do you have any other questions?
No, those are just the two. Yeah, you answered everything else, so thank you.
Excellent. Thank you so much for joining us today.
Yes, thank you so much for joining, and thank you, Dr. Jun, for all this great information. I'll be happy to post this online so that other students can view it and provide your contact information for anyone that reaches out and wants to connect with you further.
Of course. Thank you so much.
Yes, and Robert, if you'd like any more info, feel free to email us anytime. You can email me directly. It's lbeer@kgi.edu, or if that's hard to remember, admissions@kgi.edu as well. Thank you.
Thank you very much.
All
Bye-bye.
right. Have a great day. Bye.